we go directly now to Didier.
Yes, hello everybody. So I will speak about how to accelerate clinical tests and even how to accelerate medical research for longevity, a few legal, scientific, technical and political aspects. Just can you confirm that you can see me, yeah? And you can see and you can normally also see the screen. Okay, a few facts and scientific aspects that most of you already know, but just a reminder. Today, like every day, about 120,000 people will die of diseases related to old age. More than 10,000 dying of the disease, the COVID-19. So average age of death for people dying of COVID-19 in a country like Germany is 81 years. The death toll of disease related to old age, it's even in the poorest countries, more than 50%. In the world, 70%. And in rich countries like US, European countries, 90%. We die of cardiovascular diseases, of cancers, of neurodegenerative disease, of course, but also falls are related to old age. Infectious diseases, not only COVID, is related to old age. So we die almost only of old age. Old age is a very complicated process. So this is the schema made each year by John Ferber, who is here, I think. Complicated process, many things we know, many things we don't know still, or probably many things that we still don't know. But the good news, you all know about it. Average lifespan is rising, is still rising. Well, during the COVID, we don't know yet, but probably still rising. About 3 months, 2 to 3 months a year, since more than a century now. Okay, this is the good news, but less good news that people too often forget is the maximal lifespan is not going up lastly. So at the beginning of the Roman Empire, in the year 3 of our era, died one woman who died when she was 103 years old, and the oldest person in the oldest woman in the world at the moment is 118 years. So the gain of maximal lifespan was less than 20 years in 2000 years. You all know probably that the maximum at the moment is 120 years for Jeanne Calment. Maybe you don't know that the oldest man, not woman, just turned 112 3 or 4 days ago. And yeah, we don't have a real progression for Alzheimer's diseases. I think, and many of you think, that it's probably possible to find a treatment against aging within 15 to 30 years, but it will be complicated, expensive. Why? This is the theme of today, specifically of one of the themes of today. Why rats and mice are great? Well, the rats and mice are great because they are small. Rats and mice are great because they are short-living, so interesting to study for a maximal lifespan. And because they have a maximal lifespan. So for humans, like for mice and for rats, the maximum is not going up. The maximal lifespan is not going up, sadly, but also positively, because so we have something to test. Rats and mice are great also because we can use transgenic mice with human genes, because that's something I didn't know just a few weeks ago, because rats and mice have a kind of menopause. So an adult rat is 6 months 6 months old, sorry, and the fertility of a female rat is going down or stopping after 10 months. So if we are studying longevity, fertility is a part of longevity. If we are studying fertility with rats, we can use female rats and have very interesting results and information after only a few months. Surprisingly, there are not much statistics concerning maximal lifespan of rats and mice. This is for me something disappointing. Maybe some of you know more about this, but actually when I was trying to find real good data, it's difficult. And it's difficult also because, yeah, there are false claims. So if you Google, for example, the oldest rat ever, you will find that the Guinness Book is saying that there was one rat dying when he was, he or she, I don't know, was 7 years old. But no, it's almost certainly, well, let's say it's certainly not exact, like it was not exact that in the year 1635, one guy was reaching 152 years, and still he's buried in the Cathedral of Westminster with the information about this false news once again. Beware also of healthy lifespan. So healthy lifespan, of course, is our goal, but official statistics concerning healthy life extension, healthy life span are not very reliable. So here on the right, you have a description of the official Eurostat concerning the healthy lifespan of people at the beginning of the 21st century. And you can see that there are very, very big differences, very big moments where people are supposed to lose healthy life span. Well, of course, this means that the statistics are not reliable. And really, I think very important, it's one article that I read just a few days ago, saying so that increased health span should and must automatically increase lifespan. If diseases are delayed, an animal will live longer. So this idea that that it's possible to have a longer health span without having a longer lifespan is really not, let's say not serious enough. And that's at the same time good news, but problematic news, because many people use this notion of healthy lifespan. What do we need for clinical tests for longevity? So we need simplification, of course. We have more scientists than ever in the history of humanity, but we have also more bureaucracy than ever in the history of humanity. And this has as a consequence that we have kind of inverse Moore laws, Moore's law. We have minder new drugs now than a few years ago, a few than during the end of the 20th century, for example. So we need a less bureaucratic and faster system of authorization. We also need a kind of a paradigm shift, so that the priority is going to be priority for longevity, a kind of a Manhattan project with many clinical trials with public and private money. And for me, there is one, if there is one big lesson of concerning COVID-19, it's probably kind of a depressing one. Is even when you have a lot of money, even when you have many scientists, even if you have a lot of motivation, this is not enough. So probably, but I'm also curious about your opinion, probably problem number one is trash in, trash out. So having much data is not enough. You need good data, and we didn't have it during this crisis. So there is a famous prime minister, British prime minister, who once said there are only three kind of lies: dumb lies, and statistics. I don't think this is exact, but I think it is very complicated to have good statistics. So we could use what sometimes called altruist databases, so databases that are made by people who are volunteer and without any commercial goal. But the problem is, when you have only volunteers, you have a bias. We could use all databases together and mix them together, but there also, if one of these databases is corrupt, all databases are actually corrupt, or actually the results will not be reliable. And you have all these problems together when you use hospital databases, big pharma databases, and social security databases, because it's only on a voluntary base, and you have many biases. So what should we do? We should have more open science. We should curate data. And sometimes we should really begin again from scratch. Of course, the possible therapies should be available for everybody as soon as possible. And there are ethical questions to be solved. Clinical tests for humans. What's happening at the moment in real tests? Not much. So there is Lisparish, there are a few people, but not so much. And the speech of Nir Barzilai was great, but the TAME test is still not, TAME experiment is still not started. The ICD classification is going better concerning the diseases related to old age, but not enough. And maybe we should have, that was one of the ideas, that was an idea made by Alexander Stolzing, international committees to create standards in aging intervention in testing and biomarkers. We need double-blind experiments. We need volunteers, old volunteers, well informed enough, in good health, interested for themselves and for the community. Of course, we need to test good products or therapies. I don't have time to go at all in the details. We need good biomarkers and public results. And we absolutely need public results, even when things are not going the way that we want, because we have to open doors, but we have also to close doors. I always say that, especially for the test going on with blood that that Heals is promoting. Yeah, even if the results are negative, it's very important to know about this. Of course, like Alexander was saying, and many other people also, we should use artificial intelligence to go further. And what I wish, that's the personal part of this, what I wish is no patents, or at least not for everything that is paid with public money, with this concept of patent left. Okay, that's already all, except to say that, more equality and equity tomorrow between old people and young people, it's absolutely necessary. So with more reservation, there is a kind of a duty to rescue for scientists in biology everywhere in the world. And here I want to thank all people working on these fields. So, for example, Heals, the International Longevity Alliance, the Life Extension Advocacy Foundation, who is doing great work in promoting the ideas. And if you don't have time to speak during this meeting and during the working groups, you are always welcome to send an email. I always answer, especially when people don't disagree, but even if you agree. Thank you.
Thank you, Didier. I'm sure you get 100 emails by tomorrow. So maybe thank you for your presentation. There were maybe also some controversial points. So normally I would ask one quick questions, but now we take it into the working groups.